So I'm going to speak pretty briefly tonight because I know those of you who haven't finished your desserts will want to do so. The only thing that's worse than talking after dinner is talking before dinner before everybody gets theirs, and there's nothing worse than hearing someone say, "That's okay, I'm almost done, just 34 more slides." And you know who you are. But I wanted to just say a few things when I was asked to talk tonight about what I think is the importance of the future of social insurance, and something that I do feel passionate about, and that is of the things that we all can do to try to help promote and keep the social insurance that is such an important part of the fabric of our society, and that I think goes often unrecognized by a lot of people, although they depend upon it every day. They'll tell you in polls they don't believe that Social Security will be there or Medicare will be there, but look at their actions, as I was, as I was taught as an economist to always do. Don't ask what people say, look at what they do, and they act as though they need Social Security and Medicare every day, and indeed I think that is the case. To some extent, I'm preaching to the choir tonight, I think, but this choir is one that is heard in Washington and elsewhere, and I think that's a really important role that we all can play. We need to reinforce the message that social insurance was not only relevant in the 1930s when Social Security came in, and the 60s when Medicare came in, but today as well. And in fact, in many ways, as I'm going to try to say for a few moments, I think it may even be more needed than it has been in the past for a number of reasons. But the good research that people in this room do needs to be done and continued to remind decision makers about the implications of proposals to change these programs, to think creatively about change when it's necessary, and to stand firm when it's not necessary in indicating that to policymakers. And for those people who are members of the Academy who are not researchers, but rather are folks who are in the trenches every day running these programs, making sure that they meet the needs of people, making sure that they are operating the way that they should. The good stewardship that goes behind that is also part of the success of this program, of these programs, and a critical aspect of what we do, and I commend all of those actions. For example, I was very thrilled originally when Steve Goss was the first winner, I believe, of the Robert M. Ball Award. It's something that is really wonderful to see a public servant who gets recognized for that wonderful work that he does. The basic reasons and rationale for establishing Social Security in the 1930s and Medicare in the 1960s really have not changed. And they are fairly standard, and we can talk about them. I will leave a few out, I'm sure, but think about some of the basic reasoning behind social insurance programs. First, financial security and health insurance represent insurable events. That's an important piece of the whole notion of social insurance. Saving for retirement is great, but there are always those times in which the unemployment, healthcare problems, and so forth intervene, family crises and challenges that mean that people don't save for retirement in the way that they can. Health expenditures come along in ways that work as the reverse lottery, taking away people's life savings, causing other problems, and without Social Security and Medicare, life would be much worse for America's seniors and people with disabilities in the United States. Moreover, it is important to understand that society has a stake in these insurable events as well. The stability that Medicare and Social Security provide is something that is important to families, to the individuals themselves, and to society as a whole when it bolsters the living standards of people in their later years. We've chosen to think of social insurance in many ways in the United States as for people at the end of life. It's not necessary that that's the only place where it occurs. It was a good place to start. I think that we've made some inroads in some areas like the Affordable Care Act, but also the Earned Income Tax Credit and other things that can be thought of as moving towards social insurance in some ways, although they lack some of the characteristics of social insurance and perhaps could benefit from moving further in that direction. Another key aspect of social insurance is its progressive nature. That's an important element and one that's not always obvious to individuals, but is essential and has been there since the beginning and is something that needs to be celebrated and protected, and that's something that I think is really important today. Linking programs to the direct contribution for them in the future, I believe, has strengthened the loyalty and acceptance of these programs, and that is one way in which, for example, Social Security and Medicare are different than programs that are nonetheless very important, like Medicaid, and may help explain why those programs are treated better and thought of more positively by individuals. They believe that they have a stake in the system, they've contributed, and they believe they have an earned right for those benefits, and I think that's really important. Related to this, and another thing that makes social insurance very different than other kinds of benefits that we have in our society is a focus on inclusion rather than exclusion. Americans like to think about ways in which we can make sure that nobody who does not deserve a benefit gets it. We're really careful about that. We've got tough eligibility standards, we've got checks, we've got balances, and we're happy in many cases to make sure that nobody gets into a program that shouldn't belong. And in that case, we make the error sometimes of excluding people who should not be excluded. When our emphasis is on doing so to keep people out. Social Security and Medicare have always been more about inclusion, and I think that's a really important element and something that should not be left aside when we talk about these programs. It's analogous to statisticians who talk about type 1 errors and type 2 errors. If you push too hard on one thing, if you push too hard on making sure that you've got really tough eligibility standards, then there are people who are just never going to apply. And fortunately, Social Security and Medicare are not that way. And finally, I believe that the private sector has never been able or willing to fully take on these protections. It is not because the private sector is evil or anything of that sort. It is not the business of private companies, for example, to redistribute income in the United States. We shouldn't simply expect that to happen. It is not the business of private industry to be able to pool risks in the same way that you can pool for the whole society that Social Security and Medicare do. So when we get enthusiastic about thinking about the private sector stepping up to the plate, it's simply not going to be able to. And in many ways, Social Security and Medicare allow the private sector to do things that it never would have otherwise been able to or willing to do, such as supplement Social Security, such as supplement Medicare in terms of additional programs that wrap around these programs. Moreover, we're in an environment in which employers are finding it more challenging in many ways to provide all of the benefits that people otherwise might come to expect, particularly if we relied upon the private sector to do so. Even though these are basic tenets, they're tenets that have remained in place today, and I think that as things have changed, some of these elements have become ever more important. At the same time, when people sometimes talk about the world is changing and therefore we need to go back somehow to something else, that the need to fit new changes and situations is appropriate to then see some of our programs change, but not simply because it's politically expedient to do so or it's become inconvenient to talk about things. For example, the rising costs of health care over time explain a lot of Medicare's growth, but that's not a problem that we should lay at the feet of individuals. That's something that is more of a systemic change that has occurred that needs a systemic and concerted effort to improve in the future. So rather than saying Medicare has become too expensive, we have to pull back, in many ways, the high costs of healthcare mean that we have to be doubling down in terms of trying to retain these programs and improve them over time. So what are some of the changes that have occurred that I think we need to be cognizant of and working towards? First is inequality. You're hearing a lot about that these days, but it's been around for a long time, and it's been getting worse for a long time. And it's something that social insurance does help mitigate to some extent. We need to figure out ways in which we may want to think about changing that further. For example, particularly in the case of Social Security, which is a direct reflection of the inequality that occurs in the wages and salaries that people receive over time, and to some extent in the dropout years that occur when you have a Great Recession where young people don't get jobs for many years and may have some problems. Social Security is there and the rules can help it, but some of those rules might need to be thought about and changed over time. We talked for a very long time, for example, about potentially increasing the number of years that are required to become eligible for Social Security benefits. But if we're going to have periods of insecurity like we've had with the Great Recession, we may need to think about whether or not that's really a good idea. We may need to think about whether or not we want to make the formulas for calculating the primary insurance amount more progressive rather over time to account for and adjust for some of these inequalities. As the share of income going to the very top of the population has gone up, we may want to think about rules that say that Social Security is funded by a tax that is capped at a certain level, and we may want to think about changing that. These are all the kinds of changes that you might want to think about and consider, not to retrench from the program, but to adjust to important societal changes, and in this case, inequality. A second major change that's been occurring in the United States may be a little bit more of a self-correcting issue, and that is the age of retirement. I was doing a lot of work in the years when everybody was wringing their hands and saying, the age of retirement is going down, down, down. What are we going to do? People are going to spend a third of their lives, lounging around and drawing Social Security. That has actually changed. But what has not changed are some of the other things that are going on, such as longer life expectancy and so forth, that we need to think about. We need to think about what is the right balance and what do we want that right balance to be. Some of those changes may be different than what we're anticipating, but they are ones that may be driven by societal changes. Pardon me. A third change that's been occurring is the cost of health care, which I already sort of presaged a little bit by suggesting that that's something that's a little bit of a blame the victim kind of issue at the moment, where we want to point fingers and talk about retrenching on the Medicare program. But Medicare, I would remind you, has never been a generous program, particularly. And the much higher rise in prices for healthcare than for other goods and services is felt directly not only by taxpayers and the federal government, but by the beneficiaries in terms of their higher out-of-pocket costs. And employers recognizing this are stepping back and not stepping forward. Again, a rationale, a reason for thinking about whether or not we want to change in the direction that some people suggest of retrenching on the program. And finally, the private sector, we need to think about how those changes are occurring and whether or not the private sector is ready and willing and anxious to step up to the plate. I think the attempts to privatize Social Security are kind of over. We don't talk about that very much anymore. The Great Recession kind of put that to bed for a lot of people, as well as a number of other elements and things, including, I think, good research that showed to individuals that Social Security is not a bad deal for individuals. And I think that a lot of careful analysis that went in did help to kind of smack back some of the movement in that direction. The changes in Medicare are more difficult to deal with because Medicare is a complicated program in which you're not providing benefits directly to the individual, but instead you are providing benefits that come through a third party, that is, the providers of services. So there's a lot of things that could potentially be done, as well as mischief to be made. But that leads us, in many cases, to be both more enthusiastic about potentially finding ways to solve the problems, and I think that might be good. But I would also caution that we need to be careful in remembering and keeping our eyes on the prize of what the goal of the Medicare program is, and that is not just to compensate providers of care reasonably, which should happen, but to protect the beneficiaries of those programs and making sure that that's preeminent and looking at it. And that means making sure that we have a system that treats the providers fairly, but that also holds, we hold ourselves accountable for improving the situations over time. I think that improvements can be a win-win if we find ways to have greater efficiencies in healthcare, but one person's very inefficient benefit is another person's vital service and a provider's important income, and that makes it very difficult to deal with this. So Medicare has the promise of being something there's more you can play with, but that also means that there's a lot more damage to particularly be done. And I would caution people about the whole notion of empowering consumers. I'm all for empowering consumers, but not if what that means is we're empowering individuals to charge consumers more and hence impoverishing consumers in our zeal to make them greater and more effective consumers of health care. Few of us are excellent consumers of health care when we are sick, which is when it costs the most and when it is the most productive to find ways to save costs. That's something that I think we have to think of as a partnership that exists among consumers and providers and the federal government, and I think there's a very important role for the federal government to play in mitigating all of these kinds of changes. So I think that I would just close by saying the increased skepticism about government and the hostility to higher taxes can be exploited by those who argue that we've outgrown our need for these social insurance programs or that we can no longer afford them. And I don't think either of those claims is true, but unless people like those of you in this room stand up and say very firmly, these are important programs, they do the things they are intended to do, sure they can be improved, but let's not throw the baby out with the bathwater. We will be in trouble. So it is important for all of us to really take this as a challenge to keep the notion of social insurance alive in the United States. Thank you very much.